Patient's foot and ankle. I'm going to assess long axis distraction of the mortise joint. Long axis distraction of the subtalar joint. Have the patient lay on their back. I'm going to assess A to P, P to A glide of the distal fibula. S to I to S glide of the fibula. Inversion, eversion of the subtalar. A to P, P to A shear of the mortise. A to P, P to A shear of the subtalar. Tarso, metatarsal glide. I'm going to assess the digit. Assess the patient's knee. Assess A to P, P to A glide of the proximal tibia. A to P, P to A glide of the proximal fibula. S to I to S glide of the fibular, proximal fibular head. Medial and lateral shear. MCL and LCL shear. Internal, external rotation of the tibia. Patellar motion. And then lay it face down for me. Distraction of the knee joint. Assess the patient's hip. First, I'm going to assess flexion of the hip. Extension, sorry. Good. Flip over for me. We're going to now test flexion of the hip. Okay. Now I'm going to test internal, external glide. Rotation of the hip, sorry. It popped.
Oh my god.
What? You have no
Doing
motion,
great.
sir.
Doing great.
So good.
Keep going. Only a few
Now I'm
more.
going to assess posterior glide of the hip. Okay, and distraction of the hip joint. Patient, be quiet. Okay, I'll do a muscle test on the patient's lower extremity. I will now test the glute medius. Hold. Okay. I will now do a navicular / psoas test. Okay, I'm pushing down, you're holding up. Hold. Okay, I'll now do a quad muscle test. Should bring your knee up, sir, for me. Awesome. Okay, I'm pushing down, you're pushing up. Hold. Okay, I will now do a rectus femoris test. Should I keep the knee up? No. Okay. Okay, hold up. Push. Hold. Okay. I'll now do a TFL. Okay, I'm pushing in, you're holding out. Hold. Okay. A foot and ankle protocol for pronation. Sorry for navicular. Cuboid. Cuneiforms. Met heads. There you go. Ooh, talus. Calcaneus. Phalanges. And then fib head. I'll assess the patient's foot and ankle in supination protocol. I'll assess the navicular and cuneiforms. Cuboid. Med heads. Talus. Calcaneus. Phalanges. And then fib head. Do alternate talus prone. Okay. Alternate talus knee flex. Okay. Flip over for me. Do an alternate talus supine. Okay, and then I'm going to do the great toe. The assessment, I'm going to start with the patella. I'm going to assess and then correct if need to. And I would thrust in the direction of the restriction to correct. Okay, I will now do an assessment on the knee. I will lock out the knee. First find the knee, lock it out, and then go lateral and medial. Okay, I'll now have the patient flip over on their stomach and prone. Okay, I will now do a medial condyle wrist extension. Okay, lateral condyle wrist extension. Okay, and if it was posterior, I would do a medial, then lateral. Now I'm going to do a medial condyle prone knee flex. I'm going to tissue pull lateral to medial. Okay, and I'm going to do a lateral condyle with tissue pull medial to lateral. And if it were to be a posterior, I would do medial to lateral. Medial then lateral. Now I'm going to do an anterior femur wrist extension. Got my little thumb condom. Okay. Okay. Now I'm going to do anterior femur posterior glide. Okay. And I'm going to assess and correct hip internal rotation and external rotation.